Just to conclude, could you give us your top 5 benefits for taking omega-3?
Key here, I suppose I often talk about when I'm lecturing that omega-3s are our most powerful natural anti-inflammatory from a dietary point of view. They have a very broad spectrum effect, and they have effects that sort of mimic at a low level the two most common groups of pharmaceuticals that are used as anti-inflammatories. So the steroidal anti-inflammatories, the ones which are based upon cortisol, for instance, omega-3s, EPA and DHA, have a mild effect, a mild anti-inflammatory effect that simulates the type of mechanism that cortisol has. Similarly, the other group are the non-steroidal anti-inflammatories, things like aspirin and ibuprofen, for instance. And again, omega-3 fatty acids, EPA and DHA, have effects and have mechanisms that mimic a low level of these non-steroidal anti-inflammatory drugs. So in a sense, EPA and DHA are the perfect natural anti-inflammatory. So anti-inflammatory effects is number one. And that links into some of their other effects as well, because if you look at where omega-3s are probably most used and most recognized for their use, it's in heart health. And what we understand now is that most heart disease, atherosclerosis for instance, is driven by an inflammatory effect or driven by an inflammatory process. So the anti-inflammatory mechanisms of EPA and DHA play very, very well into the observed effects that you see in terms of benefits from heart health, EPA and DHA and fish oil generally. As well as that, so heart health, I think, comes in on that, and within that, I think the related sort of triad of heart health related syndromes, so diabetes and metabolic syndrome, which is almost like a pre-diabetic state. So this triad of diseases, very, very common and serious diseases that affects particularly Western populations. So overall, cardiovascular disease, diabetes type 2 and metabolic syndrome, all linked by the obesity issue. Omega-3s, EPA and DHA, highly effective as a supplement to provide benefits in all of those syndromes. The other one that I think has gathered a lot of attention in the last several years has been the effects of omega-3s on cognitive function and brain health. When we consider that DHA constitutes about 11% of the dry weight of our brain, so it's the most common fatty acid in our brain by far, and it constitutes a huge amount of, if you like, the structural building block of our brain and our neural tissue overall, then it stands to sense that fish oils, omega-3s, EPA and DHA, particularly in this case the DHA, is very important in cognitive function. And what we know is that again, there's much evidence now of beneficial effects in terms of depression, in terms of Alzheimer's disease, in terms of cognitive function from a learning and reading point of view, particularly kids. All of these are beneficially affected by EPA and DHA. So that's, I think, number 3. I think the other one that, again, it comes back to the anti-inflammatory mechanisms, but joint health and skin, but particularly joint health, has always been traditionally associated with cod oil. And there are reasons for that, and that is the joint health. So if you're looking at osteoarthritis, generally not considered to be an inflammatory condition, but it is, because the most common treatment are non-steroidal anti-inflammatory drugs, so the connection is obviously there. And so, if you like, common arthritic conditions are inflammatory conditions, and so omega-3s will undoubtedly have benefit, and the observed use and traditional use of omega-3s attests to that. Finally, there's some very interesting data coming out now in terms of the effects that EPA and DHA, just these two fatty acids, may have in terms of weight management, particularly how we metabolize and absorb fats. Some very interesting data, and we've also done some work, and what we are tending to see is that people who take omega-3, so fish oils, on a regular basis will naturally start to lose weight, and the weight is not lean muscle mass weight, it's basically fat loss. And we think there are a couple of mechanisms for that. One is a satiety, so an appetite suppression effect. And it basically comes from this, that these long chain omega-3 fatty acids, EPA and DHA, are actually difficult to digest, and they, in our digestion process, they are the last fatty acids that get digested and then absorbed through the gut. What tends to be the case then, because of that, what our gut, it senses that these fatty acids are still there, even though the food bolus that we've eaten is coming to the end of the jejunum, which is a part of the upper GI tract. And once once the fats are still sensed there, it sends a message back to the brain to say stop eating. So a lot of interest at the moment in terms of weight loss is in appetite control and stopping people wanting to eat rather than trying to, if you like, stop them eating even though they are hungry. And it looks like EPA and DHA might be very, very effective in that. And we've done one clinical trial now, which has demonstrated that DHA had a very significant effect in terms of enabling, and there wasn't any other variable involved here, enabling overweight and obese people to significantly lose weight.